Hello, my name is Francis Sarmiento, and today I'll be discussing advanced care planning for palliative patients. So to start things off, what is palliative care? Palliative care is an interdisciplinary or multidisciplinary approach to medical provision that is aimed to optimize the quality of life of patients that are currently facing or slash and is nearing the end stages of their lives. Usually, palliative care is provided for individuals that are plagued by serious, progressive, or complex illnesses. So, this concept is aimed to provide medical attention that can help improve palliative patients' living conditions. Basically, a way to make things easier for them while they're nearing the end stages of their lives. As well as give them a sense and a certain degree of autonomy when making decisions that will affect their quality of life during difficult times. In this presentation, I'll be going over the following things. So, ACP and its effects on the patient and their family's satisfaction, ethical decision making that concern ACP, and the requirements for effective communication in a palliative context. So first things first, what is ACP? ACP, or Advanced Care Planning, is one of the essential components in palliative care. This involves working in a multidisciplinary team framework between the family and patients as well. And multidisciplinary team framework operates by incorporating a group of professionals that can cater to the personalized needs of the patient. So advanced care planning is a quote-unquote plan that is written by the patient and other health specialists that can cater to the patient's wishes once the patient has reached the stage of the disease/morbid illnesses that makes the patient unable to make decisions for themselves. In other words, it is a set of advanced directives that the patient has already planned out while they still possess the sound mental capacity to plan. And also, advanced care planning can provide many benefits to the patient and family. So, one of these would definitely be the reduction of stress and anxiety that is provided by the emotional toil that accompanies the distressing situation that the patient is experiencing. And so, advanced care planning also provides respite to family members. Respite is a short period of rest or taking a break from something difficult. In this context, it is the process of undergoing a time of grief with the family of the carers of the palliative patient. And respite is proven to reduce the burden that occurs naturally within carers of palliative patients. This also includes the families and relatives of the palliative patients. So, all in all, advanced care planning is important in palliative care and is an important element of it. Next, I'll be talking about ethical decision making concerning advanced care planning. When it comes to decision making in palliative care patients, it is very important to ensure that the patient maintains dignity when at the end of life stage during the palliative process. Dignity is an aspect of palliative care that should be maintained during the end of life process. It is to be approached with respect as it has various cultural, social, and mental implications to the families and the patients. Thus, dignity should be integrated with the advanced care process and should also be kept in mind when planning and providing palliative care. One of the main values in palliative care and advanced care planning is ensuring that beneficence is implemented. Beneficence is to act in the best interest of the patient. It is to ensure that the palliative patient is provided all the benefits with decreased or lessened possible risks or harm. Another ethical consideration should be that decisions are made with the patient's autonomy in mind. Autonomy is ensuring that the patient is given the right to decide whether to take or refuse medication. And also, autonomy promotes the decision-making capacity of the patient. Upholding the patient's autonomy also helps in providing physical and emotional strength by, letting them assume control in making decisions over their health conditions. Overall, ensuring that when planning an advanced care plan with the patient, certain ethical considerations must be made and implemented. Similarly, something that should also be implemented and properly considered is effective communication. Effective communication must be established between the patient and their families to ensure that there is no confusion when at the planning stage of the advanced care plan. Communication is also not limited to just communication between the patient and the multidisciplinary team/nurses, but ensuring that the information delivered is adequate and to consider not just verbal but also physical cues that the receiver of the information is emanating to make certain that the information delivered is understood and taken in well. This is also a form of educating the family and the patient of anything they don't understand. This provides a certain level of reassurance that can calm the patient and family. Thus, it's important that effective communication is established and carefully delivered. So, in conclusion, advanced care planning is essential as an essential element in palliative care. It is paramount to understand what it means, certain ethical considerations that are attached to advanced care planning, and that it must also be delivered through careful and effective communication in a palliative context. So, my name is Francis Sarmiento. I'd like to thank you for listening to my presentation about palliative care planning, and I hope you've learned something new today. You have a good day.